Hi guys, I would like to introduce you to the main topic of my thesis, which is the management of lower back pain thanks to the breathing and isometric type of exercises. Lower back it is a condition that nowadays almost each of us is going to experience sooner or later, and it is a quite common but complex issue that is affecting people of all of the ages. This type of pain, it is something that it doesn't have to do with a type of job that is just only physical. In my experience, I've seen a lot of people having sedentary type of job experiencing this pain more than people having a physical type of job. I don't have the statistics in my hands, but at least it seems to me that it's affecting more those people that are having sedentary type of job. And most likely it's because they are not doing any type of movement, if it makes sense, that compared to the people that are having a physical type of job, we can say that there's a little bit more of activity in terms of physical activity with their body compared to the one that are not having it at all, and they're keeping bad postures for almost their entire day, if it makes sense. Therefore, lack of movement, it seems affecting more those people that are less experiencing a risk of spinal cord damage, disc type of damage, nerves type of damage that comes with physical type of job. In my thesis, I'm going to present with more emphasis of the anatomy of the lower back, starting from the bones, going to the nerves and stuff like that. Basically, whatever it is surrounding the structures that I'm focused on. And I'll be just going through all of the details, especially what is interesting me, which is the muscles and the innervation, and what type of muscles can be triggering type of pain that it is commonly perceived as a lower back pain, and it's commonly related to bad postures, muscles, and stuff like that. I'll also discuss the main cause of lower back pain, going through what I've experienced as the most common causes, and and I would say that in between all of those things that you are seeing now on the screen, poor sitting posture and frequent bending forward behavior habit are the main issues that are then creating degenerative conditions, problems when we are just doing some heavy lifting, traumas because we are not having muscles ready for actions if there's going to be the need of using them, if it makes sense. Therefore, they would be like more inclined to have problems because we are now discussing about situation where muscles are not ready to work because of a sedentary type of job, and all of a sudden there is heavy lifting type of activities that could create problems and traumas, if it makes sense. One of the things that I've seen often related to the lower back pain, it is the pelvic anterior tilt, which is, as you can see it in here, a condition that is making the whole lumbar structure more compressed, compressing the whole structures in there, the nerves and the vertebrae, and creating less space. Therefore, creating even a condition where there could be fractures and pressure that it's useless, and it can be really managed in a good way through like exercising and awareness, because that's also important and no one is really considering it. Therefore, in my work with this thesis, I would like to introduce you how and well, I would like to introduce to my patients that are going to work with how strengthening these muscles and those structures can be creating an impact, a difference, and could make a difference with management, with their lives, managing all of this pain that they are feeling. And strengthening without movement, it is something that it is quite important because all of these isometric type of exercises can build muscles endurance and can be performed in a static position, which is very important in terms of, okay, I can do these type of exercises too. This type of mentality, I would like that could be a little realization in the mind of the patients, because every of us it is experiencing somehow pain when, when every of us, okay, let's put it in this way, when each of us is experiencing pain while doing some type of action, after feeling it two times, we would make corrections. We would just compensate. We would just not use the hand if, for instance, the shoulder is hurting, and we would not do it even more if we know that can be potentially dangerous and can be potentially creating more problems. Therefore, people that are having pain in the lower back, one of the things that they do not want to hear is the word exercise, because they're thinking that any type of exercise is going to create just pressure at that point, more pain, problems that can lead to operation and stuff that they don't want to experience in their life. They just want that the pain could go away. But thanks to the strengthening without movement, which is the basic of isometric type of exercises, we can have a low impact option that is improving the blood flow, the endurance, the stability, without additional stress that the lower back may have, and potentially solving even the problem of the pelvic tilt that we were discussing before. If the isometric type of exercises then could be a little bit too much because it's still something quite challenging in terms of coordination, strength, endurance, and so on, people have to get used to this stuff. They could always start with the breathing type of exercises that is still something related to improving the pelvic tilt. So by inhaling and exhaling, but especially if having a correct position and inhaling properly by using the diaphragm, there is an expansion of this muscle which can lead, if properly assessed, to a correction in a way of a pelvic anterior tilt, and it can be a start of some sort of isometric exercises logic, and introduce people to experiencing movement of the lower back, pain of the lower back, by not feeling pain at all, which is a very important step, because they realize that, okay, it's less hurting if I'm just doing like these type of breathing exercises. Let's move to something more active, like, or more challenging, like the isometric type of exercises. And speaking of these active isometric exercises, in here I can show you something that can be perceived, can be used as isometric type of exercise, and yeah, that can be perceived as challenging, I wanted to say. Of course, this is like a quite complex type of exercise in terms of coordination and coordination with the posture and maintaining this position. There's variations that that are somehow similar to these exercises, but by standing on your knees rather than your feet, making it less challenging and more easy to access. I don't know if I can say so, for the beginners. So like making it yeah, like easy to just do it at the beginning. This is another type of exercise that can be used as isometric exercises that is improving like our core and creating these isometric type of force within the lower back pain if done properly, and creating like all of this compression, improving of the blood flow, and strengthening of the structures of the lower back. In conclusion, what I would like to present in my thesis, going through better details, and I'm including better details, even the exercises that I was showing you before. Those are active isometric type of exercises examples that are very common and that can be used even in the therapy. And I would like to introduce people with my work to those exercises that seemingly they look impossible to those people that they are experiencing lower back pain, but that progressively, starting from the breathing exercises, going then to mid-step or yeah, type of exercises that are similar to the ones shown you in the pictures, that they can do it, that they can managing their pain of the lower back thanks to a proper strategy, an effective strategy that I would like to present in my thesis through pictures, through patients working on a weekly, like I don't know, twice a week, something like that, for 3 months, and see the effectiveness of um, of the work done, and make them realize that after all, moving their back in an intelligent way through like strategies that they can apply in their lives can be a potential a leading factor that is connected with the management of their lower back pain. And as far as I experienced that, if there is no like a more important conditions, these can lead to not having the back pain anymore, or at least each time that accumulation comes to your life, you can just take care of it by doing what you know. Breathing exercises, avoiding certain postures at work, and do the isometric exercises that I briefly suggested in this presentation. And that's it.